Okay, we're gonna skip over how much county money, just because I did receive the link from Amanda.
Okay.
But can we do quick audio checks?
Sure. Testing, 1, 2, 3.
Oh yeah, it's perfect, loud and clear.
Okay, great.
So in regards to how much county money is being spent directly towards addressing the fentanyl crisis, has that number gone up or down in the last 3 years?
It's been going up year by year, actually. We're able to put a little bit more in than prior years.
And then let's kind of talk about where exactly the money's going. Prevention, treatment, enforcement.
Sure.
Would you say what's being prioritized in recent budgets? Because I know it kind of goes into those 3 categories, but is there a category where there's a little less or there's a little more?
Sure, we can address that. And by the way, most of the funds that we're using are coming in from 2 categories. One is one category is the opioid settlement funds. The other one is the mental health sales tax. So the settlement is from pharmaceuticals, large drugstores, etc. It's been a national settlement over the last few years. And then the mental health sales tax is a local sales tax that was put in place, I think, in 2019.
And then on the pharmaceutical side of things, not to interrupt you,
sure,
but is the reason kind of behind that is they're starting to see more people misuse drugs being given out, or there are doctors who are prescribing certain drugs?
There were these settlements and these lawsuits. Sorry, let me start over. These settlements and the lawsuits really have come about that because over the years people or the public has been aware of the fact that a lot of the opioid addictions have come from not just illicit street drugs, but even pharmaceuticals, misuse of over-the-counter drugs and prescription drugs. And so that's why that was focused on. Prior to becoming county commissioner, I actually worked at a local hospital, and I worked with the medical staff there. And I can remember that even 8 to 10 years ago, there was a direct effort there with medical staffs to address opioid use and understanding the highly addictive nature it was, and adjust prescribing methods accordingly, knowing the highly addictive potential of these drugs. So that's a lot of the reasoning behind why those opioid settlements came about. It was felt that there wasn't adequate controls, I guess, or maybe understanding, knowledge of the impacts that they could make on people's lives.
Yeah, and I can say at least majority of the population, you're gonna get a surgery, maybe you were in a car accident, you're gonna use the bottle as prescribed. But there are some people who, okay, there's 7 pills in there, they're continuing to take all 7 of them, or even sell them even when they're feeling better.
Yes, definitely one of the concerns. As far as where the money has gone, if it's divided into 3 categories: prevention, treatment, and recovery. By and large, the lion's share of the money has gone into treatment. To give you some examples of that, would be things like, we've put money into drug court, for example. And drug court is a method where we can take people that are accused or arrested for drug possession and give them an opportunity that, yes, they could go to stand trial, or they could be diverted into drug court, which means that they would have to follow through, do regular UAs, they would have to go through a treatment course and follow everything that the judge prescribed for them or ordered them to do. The good news about that is that it is a fairly successful program, and so that's why we've put more money into it, to expand that opportunity for more people. Because often when they graduate, we've got a graduation coming up soon here in the county, they come up periodically, and it often takes a couple years for them to get through it, but what they get in the end is that if they go through the program successfully, they've kicked their addiction, and in the meantime, they've gotten their lives back. Sometimes they've gotten their kids back, they've gotten jobs back, and their life's back in order. And so that's that's a tremendous success story when we can see that happen. So we wanted to invest more funds into that. We also have in our jail, something we've started within just the last couple of years was medication-assisted treatment. Addiction is a huge problem for people that are in the jail as inmates. And so recognizing that, we've decided to take that opportunity, since they're there, we've got a captive audience, and work on getting them through treatment. and not just getting them through treatment, but then once they leave, to make sure that they don't just fall off the wagon and go back to old habits. But we've had one program that helps them kind of transfer into society once they've left the jail and continue to get that assistance. Other things can include a program with Barth House, which is housing for people that are in treatment. So they have some sense of stability while they're going through the treatment, trying to get them back on their own feet and becoming self-reliant. Let's see, what else? That's a lot of it as far as the treatment. Oh, I should mention though, in the jail, not just a treatment program, but we purchased bracelets a year or two ago. And what they are for is that they're primarily for the inmates when they first come into the jail, because as I mentioned, addiction is a huge problem for the people in our jail. I'd say at least 70% of them come in with a drug issue, an addiction issue. And so when they come in and they've been arrested or put in jail, sometimes they might be in the middle of a withdrawal. And so we need to be able to monitor them closely, and that's what the bracelets are for, so that if they do have an overdose issue, then we can get medical care to them right away. In addition to that, we've put in place things like a scanner, which we've purchased, and a drug dog. And because it's amazing how many efforts are made to get drugs into the jail to the addicts that are inside. It speaks to the power of the addiction, really. And the fact that people are willing to, do anything for money, So we've seen them do crazy things. They smuggle drugs in through their private parts and all kinds of creative ways. And so we put in the new scanner to find that, to detect that. We get the drug dog in there, and he's done a great job. And we've actually been able to reduce the amount of overdoses, and by keeping drugs out of the jail. And of course, we're not going to have a lot of luck, treating addiction if we can't stop the drugs going into the jail. So hence, that's why the focus has been on that as well. And if we can help people that are in the jail kick those habits, there's a much better chance that we won't see them again there, that they can go on and live a productive life. And that's what we hope for them, because we all benefit. They benefit, society benefits, if we can put those programs in place and make them effective.
Do you know if there's some type of number of how many overdoses are happening in jail? If you happen to not catch those,
We do have some statistics on that. And in 2022, we had 29 incidents. In 2023, as we're starting to put in some of these protections, it went from 29 to 22 incidents. And then in 2024, it lowered again to 11 incidents. So in the course of 2 years, we've gone from 29 incidents down to 11. So
it's working.
We're making progress. We are definitely making progress.
And out of those, those three kind of categories of where the money's going, what area in particular do you feel is the most important? They're all, of course, important, and the money's going in their own areas. But what do you believe is the most important?
Well, they are all important, and as I mentioned before, the lion's share of the money is going into treatment, which is valuable, and I've talked about some of those programs we put in place. But the most important one to me is really the prevention. And we haven't put as much money into that because one thing is there aren't as many opportunities for programs to do it. But a couple of them include, for example, we're starting a program this fall through Safe Yakima Valley, which will teach positive social norms and drug education and awareness to youth in the schools. And this is an evidence-based program to help increase awareness and prevent them from wanting to be interested in the first place and trying it. And one of the things that they put out is they look at peer pressure and what their peers are doing in a positive way, because sometimes kids will get the idea that, well, I'll do it just because everybody's doing it. But they've done enough polling and studies that they know that most kids are not doing it. And really, if you're looking at doing what the crowd is doing, most of the crowd is not doing it. And so we want to drive that point home with the kids. So that's one program. Another thing that we've invested into on the prevention side, I guess you call it prevention, is OD MAP. And what that is it's a program we've implemented through Safe Yakima Valley, where it tracks not just overdose deaths, but total overdoses. Because that's important information, especially when we talk to our state and federal lawmakers about the funding needs that we may have. And we want them to understand the size and scope of the problem. That's why it's good to track all overdoses. Because one of the things that we've found that has actually been successful is we've actually gotten better in preventing overdose deaths through the use and distribution of Narcan, for example. And then there are times when that gets used over and over and over on the same person. So it's good because we're keeping people alive, but we still haven't solved the problem with them. And there are other issues we can address later on that.
Speaking on the map,
Yeah.
if I'm correct, I thought the map only documents overdose deaths and not just an overdose in general, which is kind of the problem almost.
No, that's the reason for OD map is that it does track both.
Okay.
Prior to OD map, we just track the deaths.
Okay.
So that's the advantage that OD map offers.
That it's both.
Yeah, it
because
is both.
You can't get the full picture kind of without both. Just having
Exactly.
deaths.
That's what we're trying to get, the full picture.
Right. And speaking on Narcan, I know this is not kind of one of the questions I put on there, but a lot of people have the impression or the idea that Narcan is bad because it's just quote unquote allowing them to continue to use. What is your kind of opinion or stance on that? What would you say to those who are critical on that?
Well, I have heard that. Have heard that argument. I'm going to disagree with it because I think all lives have value, and we should make that effort to save lives. But I'll also say that the picture is incomplete if we just say, okay, you're alive now and go your way, and then we find them. And this happens often with our first responders. They may bring someone back to life, and a few hours later the same night, they have to do it again because they've gone back to their drugs and they're overdosing again. And so one of the things that we really need to change in our state is the ITA, or Involuntary Treatment Act. This is one of the things that I actually pushed for, we pushed for as a Board of County Commissioners to the legislature this last year, to make one simple change, which is let me back up a little bit. So the Involuntary Treatment Act actually means that if somebody is causing harm to themselves and has a behavioral health issue or an addiction issue, that they can be committed to a mental health facility. They don't have a choice in the matter. A judge can order that. We're asking for a change to that law so that if we have someone on the street who has overdosed and been brought back to life by Narcan or some other means, that at that point they are a candidate to be involuntarily committed to a treatment facility or behavioral health center. And there's some people that would argue that somehow that's against their rights somehow. I'd love to have that argument to say that I'm violating someone's rights by putting them in a facility where we can keep them alive and get treatment. So we weren't successful in getting that change made to the law. And that's one of the things that I think we need to do. So it gives local officials a little more control to say, you know what, you are a danger to yourself, you need help, and you're not in a position to make that decision for yourself.
I actually have an interview with Newhouse coming up. I would love to mention that to him. I'm going to write that down so I remember.
Okay. And I'll mention the Involuntary Treatment Act is a state law, actually.
Oh, okay.
So we're talking about the state legislature on that.
Okay.
So he may not be involved, but we have local legislators like Senator King or Senator Flores, Representative Defoe, Corey, Mendoza, Manjares, etc.
No, I think that definitely be a good question to ask.
Yeah, it's relevant for them.
Yeah.
So,
okay. Yeah. Regarding Narcan, so after speaking with AMR, they, at least in the past 5 years, it's gone from 1 dose to having to give 2 or more doses just to bring someone back. And the question I'm kind of getting at is Narcan is kind of available all over the county, all over the state.
Right.
Do you remember a time where that kind of didn't exist? Because I don't know, I'm coming from the East Coast, and I'm trying to wrap my mind around the fact that it's so readily available and it's everywhere, especially on this coast.
Okay. Narcan is a pretty new medication or phenomena here in our area. I can tell you that as part of being county commissioner, I've sat on our local health board for the last 4.5 years. And when I was first on the health board, we hadn't heard of Narcan. It was maybe, I'm thinking 2 years ago, maybe 3 at the most, that it was brought to us as a treatment and medication option for these circumstances. And then the state broadened it, that made it available to anybody, that they could just pick it up, without getting a doctor's order.
Yeah, it's crazy to me that it's like all over.
Yeah,
I mean, it's a good thing. Don't get me wrong.
Yeah.
But
well, it is amazing. Yeah, its use is spread, and I think the reason it's gained popularity so quickly is that it's very effective. It's very effective. I mean, the power to bring someone back to life who was just overdosed and killed themselves, intentionally or not. It's a great tool to have.
And all it really takes is one time for something to go wrong, something to go bad, but at least you have that on you, or a friend might have it on you.
Yes.
And then to kind of back to the point of the public kind of assuming Narcan, or not even just the public, a few people, most of the population, Narcan is bad. After speaking with Save Yakima Valley, even Alicia mentioned they can have 15 different overdoses with Narcan and be brought back 15 times, and maybe that 16th time they go to get treatment. So that's kind of how she kind of sees things. Are you seeing real results from the money being spent? I would say yes, because of the programs.
Yes, I would agree. We do see successes. Some are easier to gauge than others. I mean, obviously, when we see someone who's brought back to life, and when they go and seek treatment, those are both successes. Certainly, when we see people graduate from our drug court program, those are definitely successes. Education programs are successes. The fact that we've been able to reduce the amount of drugs going into jails and start to offer addiction treatment services to them is a success. And the fact that we now have a program so that once they leave the jail, they can continue their treatment outside of jail, so they don't just go back to their drug friends or whatever and slide back into the old habits. Those are all successes. But success is expensive. It's really expensive. I mean, I can't remember what the statistics are, but what I've heard is that the average cost to take an addict to, be free of their addiction, the money goes into the millions for each success. And part of that's probably the fact that there are a lot that aren't successful. But success is expensive. We need, on top of changes to the Involuntary Treatment Act, as I've described, we need more facilities. We need a detox center. We need, I will say that the Yakima Nation has gotten some funding down near Toppenish to purchase a facility and then get some funding to turn it into a detox center, which is a good thing. I think we also need one up here in Yakima. And we need other things like permanent supportive housing. I mean, and that's where treatment gets expensive, because we're having to offer housing, and it's not just that they're probably going to be able to contribute, hopefully some to the cost of that rent, maybe all of it, but they still need services, continued ongoing, sometimes counseling, addiction treatment. Sometimes there are people that have, kind of ruined their lives due to the addiction, and they can't function on their own anymore. And so that's a lifelong problem for us. So really the greatest success of all is if we can get people to avoid it altogether, which is why the education part is so important. Getting that to our kids in school, first of all. But we also have funded a program, for example, to our Spanish-speaking residents in Yakima County through KDNA radio, We have an outreach program there that explains the dangers. Sometimes they'll talk to addicts that have been able to get through it successfully. They'll talk to behavioral health and addiction experts, and so that's been, I think, a valuable addition to our repertoire.
I'm glad you mentioned that, because I feel like, at least when I was a kid, there were so many alcohol, drug commercials that you really don't see many commercials on opioids. You still see, you know, your gun, your alcohol here and there, but it's just not as frequent as it used to be.
Yeah, well, and I do think we need more of it. I will mention that this is not us, but the Yakima Health District. Of course, I sit on their board, but it's a separate entity from the county. They do have a prevention and education program. It's actually called Escape the Escape. It's out there right now, and it's youth focused and youth led. You know, where they've interviewed youth and used them actually in commercials and kind of came to understand their mindset on the best approaches to reach youth. And so I think that's been a positive. But there's more that can be done. Right. I know that we see there are billboards out in the community here and there that talk about the dangers, but we can't repeat the message too often.
Right. I wanted to go back to the detox. Where's the closest detox center that you know of?
That's a good question. I'm not sure. I don't think we have one. Well, I take that back. Actually, Toppenish Hospital does some detox.
Okay.
They do some. I don't know whether they're going to continue to do that once the Yakima Nation has their facility up and running. They are actually, Toppenish Hospital is expanding the behavioral health unit, so there are more people there that can be there for long-term treatment, like 60 to 90 days.
That's still kind of a ways away, though. Like,
it's a ways away from Yakima. Yeah. It's close to the Yakima Nation, though. They're within. Right. They're within. I think those two centers are within a mile of each other, so that's pretty close. But the largest problem is going to be in our population center here, you know, in the city of Yakima. So we do need facilities like that here too.
This has been a great interview because I haven't had to ask you a lot of questions because you're answering them before I even ask.
Okay.
It's a great interview.
All right.
Let's see. Realistically, with the budget, what more can be done?
Well, that's a tough one. Just so you know, 82% of our general fund in Yakima County, those funds go to public safety, which means the sheriff's office, the jail, and our court system. 82% of it. It doesn't leave a whole lot of money for the other vital services that we have. Now, of course, granted that we have other places such as county roads that has its own separate funding outside of the general fund, solid waste, you know, so they're a little bit different animals, I guess, to put it in that sense. But we have limited funds. The one thing I will say that we do have, I mentioned the mental health sales tax. We do have a reserve in that fund right now, and I believe that gives us an opportunity, hopefully, to help with creating or helping support construction of some facilities that we need here in the county, on the that offer behavioral health assistance in some way or mental health assistance. One of the things that we've been able to do successfully in the last couple of years is approach the legislature on making changes to the law and how that money can be used. 3 years ago, it wouldn't even allow counties to use their mental health sales tax funds to renovate or do anything with any kind of facilities. That got changed 2 years ago. It still didn't give us a chance to help build a new facility. And the reason that's important is that sometimes you'll find with some facilities that it's cheaper to just start over than try to remodel an old building. School districts run into this all the time with their school buildings. And so this last year, Senator King actually ran a bill for us, and it passed, I think, unanimously, allowing us that opportunity to use the money for new facilities as well as remodeling old ones. So we made some progress there, and I think that'll give us an opportunity in the next few years to be able to dedicate some meaningful funds in that direction.
is the fentanyl, I can't stand the word crisis, but it's what I've been using lately.
Yeah.
Is it unsolvable in your opinion?
You know, it's not unsolvable, but it's a hard problem to solve, and the biggest reason is that addiction is so powerful. You know, as I mentioned before I was a county commissioner, I worked in our hospital, in Sunnyside Hospital. And between my experience as commissioner and working in the hospital, I've come to the conclusion that addiction is really our number one problem in this county. And I don't think that means that we're unique as a county either. I think there are a lot of counties that would say they're in the same boat. But I see it, I used to see it with patients that were admitted after they'd had maybe they've, a lifetime of addiction, or maybe a short time of addiction with some powerful drug and then just, really hit them hard. People going through the emergency room because they were, hit in a DUI, accident or something to that effect. Or they're dealing, or they had an overdose, and so they're in the emergency room for that. You see it as a large factor, not the only factor, but a large factor in our homeless population. And as I mentioned previously, a huge percentage of the inmates in our jail right here have an addiction issue. And so it's not unsolvable, but I think there are a few things that we have to look at. One is change. Well, I mentioned earlier the changes to the ITA law, so that if people actually are really, literally killing themselves by overdose, whether intentional or not, and being brought back to life, we need to get them into treatment, and we need to be able to take the choice out of their hands. It speaks to the power of addiction that sometimes when people are brought back to life after using Narcan, that they're mad at people because their high was taken away. That just shows how powerful the addiction is. The fact that people are trying to smuggle it into jail so they can continue, feeding their habit, it speaks to the power of the addiction. The people that are fully aware of the damage they're doing to themselves, but they can't stop. And part of that is sometimes the difficulty of withdrawal. Right. But part of it is changed to the ITA law. I think part of it is probably some changes to our drug possession law in this state, because it still doesn't. 2 years ago, drug possession was technically legal in this state, the way the law was written. It was written in such a way that if someone was found, a law enforcement officer could run into somebody who was using drugs in public, and they couldn't arrest them and just have to say they would refer them to a treatment facility. But there was no record made of whether they actually went to the treatment facility. So really, there was no teeth in the law at all.
It was a slap on the wrist.
They couldn't do anything with them. That's been changed, so now it's been it now is a gross misdemeanor if someone's found with drug possession. I have talked to people that are prosecutors, and they say it probably needs to be a felony level. And it's not because they're trying to throw them in jail per se. It's because the law needs to be strong enough that they can take action with him. And I've talked to people that are addicts, and one of the things they say, sometimes they're thankful for the treatment program, but they're also thankful that they were held accountable by society. And sometimes that's what it takes for people to stop and think, oh, you know what? Maybe I'm really not going down a good road, and I need to get some help. So we need some stronger possession laws, but we also need more facilities. We need detox. We need detox centers. We need permanent supportive housing. We need to continue treatment of our jail inmates, and above all, we need education and prevention. If we can keep it out of people's hands in the first place, we're so much further ahead. We save ruin, of so many lives.
Yeah, I feel like because I was also researching, I was trying to find a tie between the crack cocaine epidemic and what we're experiencing now. And the only major difference that I can see is that back then, more people wanted to get rid of it, more people wanted to help, more people were more vocal. They were very vocal. And it kind of washed over quicker than we are dealing with fentanyl right now. But you have COVID, you have mental health that came out of COVID, people buying emotional support animals, people abusing medicines that are prescribed to them, and it's just all just keeps expanding. Then what's coming up from the border?
Yes.
It's not helping.
It's really not. Now we do see some successes. For example, I mentioned working at the hospital with the medical staff. I think the medical world has become more aware of the issues and have taken a better approach. The doctors that I've spoken to and that I've worked with, and they've become more aware of the situation. I think that there could be that there's still some education to be done there, but in the circles that I run with, I think the docs or the providers are pretty aware. Pharmacists are aware.
Board.
Yeah.
And
Yes.
I would say that because whenever something happens, at least back at home, doctors recommend first something other than an opioid. They only would mention it as a last resort.
Yeah, I think that's pretty common, or it's becoming more common. And the other thing is, if they do have to prescribe opioids, they cut it off pretty quickly,
right?
Or they taper it down pretty quickly
compared to in the past, where
yes,
they might have given you 7 days to recuperate or not feel pain anymore.
Yeah, and that's just been education. I mean, doctors are conscientious people. I mean, by and large, I know a lot of great doctors, and they want to do the right thing, but sometimes you don't know.
Yeah, you don't. It's not like you know the person. You're prescribing them because you want to treat them. They're in pain. They might have just had surgery.
Yes.
They're doing their job. And they
Exactly.
can't help what happens when you leave this hospital or the doctor's office.
Yes. And of course, one thing they can't control are, once people have it, are they using it? Are they selling it? Are their kids getting into it? I mean, there are a lot of other things that are out of their control.
Yep.
So we have that, which is why we need to educate the public at large about the dangers of prescription medicines as well as the street drugs. Yeah, there are a lot of angles. Other wins though include, aside from the medical profession, the border. We have seen some success there. I've talked to our local sheriff, and he says, closing down the border has made a difference on the drug flow because they're seeing the price of fentanyl go up on the street. So so the price is so it's now, interestingly enough, that means that they're going and looking for other alternatives that are cheaper, like
cocaine.
meth. Yeah, exactly. But it is making a difference there. So there are successes. It does show that we're not powerless. We can, but it's going to take a large collective effort.
It's going to take the country.
Yeah, we all have to get behind it together. We really do. Understand that just how damaging this is. I mean, we're going to be paying for this. I mean, I'm hoping we continue to make successes. I did talk to the coroner this morning, and I kind of wanted to get a feel for overdose deaths here versus a year ago. At the end of June a year ago, 2024, we had 70 overdose deaths in Yakima County. Right now, and of course we've got 3 days left in June, we're at 59. So it's a little lower. I asked him, is it any different as far as fentanyl versus meth or others? And he says that really hasn't changed at this point. Same kind of percentages. So, it's a little bit of good news. Hopefully that grows into more good news. But it's a multifaceted problem, and it's going to take a multifaceted approach.
Yeah, Marshall mentioned to me, he's like, the numbers are lower. He's like, but I'm nervous because it is the summer.
Yes. Yeah, so so any success might be temporary there. We'll just have to wait and see.
Yeah.
Yeah.
Well, you were all set for me.
Okay.
You're great. Thank you.
No, you're welcome.